A child being stressed when there's a chronic illness diagnosis it's inherent to the disease, regardless of if it's EoE or if it's another chronic illness. Your child is immediately at risk for anxiety and stress. So anxiety is a response to the stressor. However, they might be having a lot of symptoms which would cause stress, such as not wanting to eat or finding eating to be painful, or family conflict around eating, or the child's taking a long time to eat. All of those things will induce some stress if you're 1 year old or if you're 16 years old. So it's very common, and some recent research has really underscored that children are at more risk for social difficulties, such as social isolation, because they maybe don't feel comfortable going to birthday parties anymore, or they're afraid. The adolescent maybe is afraid to go out with friends because they might have to run to the restroom because they're having diarrhea, or they might feel like throwing up, or they might have difficulty swallowing, and suddenly they don't want to look vulnerable in front of their friends, and so they don't engage in those activities anymore. And that causes social isolation, which in turn can cause some depression, and it becomes a somewhat vicious cycle. So it's not as if it's automatically a diagnosis of anxiety or psychological issues if your child has EoE, but they are at significant risk, regardless of the age. There's no kind of one-size-fits-all in terms of response to this diagnosis or how children cope with it, but there certainly are some developmental milestones where it might be more difficult or more challenging. I think parents need to be aware that there are significant psychosocial issues that will become amplified with the diagnosis.